Welcome to This Explainer. Today we're bypassing the Hollywood myths and the dramatic soap opera awakenings to look at the actual clinical science of comas. We're going to investigate exactly what happens when the human brain literally powers down in a medical emergency. It's an incredibly complex phenomenon, and I'm really excited to guide you through the data and explore the fragile boundaries of human consciousness.
Let's kick things off by busting a really common misconception straight out of the gate. You know, if you watch enough movies, you'd think people can stay in a coma for decades and just wake up perfectly fine, like they just took a really long nap. But looking at the medical reality, a standard coma usually doesn't last much longer than several weeks. The brain simply doesn't stay in this specific state indefinitely. So that brings us to our baseline definition. What actually is a coma? Medically speaking, it's a state of prolonged loss of consciousness where a person is entirely unaware of their surroundings. And the absolutely crucial phrase here is zero awareness. The patient isn't dreaming in a way they can articulate, and they're completely disconnected from the environment around them. It's this profound neurological shutdown, basically triggered as a protective mechanism to preserve minimal baseline function when the brain is under a severe threat. Now, I really want to emphasize the sheer gravity of this condition. A coma is always a medical emergency, no exceptions. If someone is unconscious and cannot be roused, it requires immediate, rapid action. Medical professionals are literally racing against the clock here to preserve the patient's life and to protect fundamental brain function before irreversible damage sets in. Moving into Section 1, recognizing the symptoms. Let's look at the observable clinical signs doctors use to identify this state. It's absolutely crucial to understand that a coma isn't simply a deep sleep. Think about it. If someone is just sleeping, you can wake them up, right? Their brain is still subconsciously monitoring and responding to the environment. But someone in a coma? They have severely depressed brainstem reflexes. That means something as automatic as your pupil shrinking when a doctor shines a flashlight in your eyes. It simply won't happen. The baseline hardware of the brain is completely suppressed. When doctors evaluate a patient, they're running through a pretty stark 5-point checklist. Beyond that lack of pupillary response we just talked about, they're looking for closed eyes and irregular breathing. Furthermore, they are checking for an absolute lack of purposeful response to pain or movement. So if an arm or leg does move, or if the body reacts to a painful stimulus, it's purely a basic physiological reflex, not a conscious controlled action by the patient. All right, on to Section 2. Causes and risk factors. What exactly are the triggers that cause the brain to shut down like this? Well, the brain actually faces a massive array of culprits. We can basically organize these threats into 3 main categories. First up, physical trauma. We're talking traumatic brain injuries from car crashes, strokes that block blood supply, or bleeding and growing tumors. Then we have systemic or internal imbalances. This includes things like diabetes, where blood sugar dropping too low or spiking too high can be a trigger, along with thyroid issues, low sodium, seizures, or severe infections. And finally, external environmental factors. Things like a lack of oxygen, toxic exposure to carbon monoxide or lead, or an overdose of drugs or alcohol. As you can see, these primary threats are coming from literally every possible angle. It's not just the sudden, violent events like a physical blow to the head or an internal bleed. It's also the stealthier threats that slowly compromise the brain's operating environment, like those environmental toxins we mentioned, profound internal disease imbalances, or the severe swelling caused by infections. Crucially, we need to talk about who is most at risk. The threat of falling into a coma actually scales up significantly with age, particularly if older adults already have underlying diseases. And we really have to highlight a major risk factor called polypharmacy, which is, well, exactly what it sounds like, taking multiple different medications. When someone is on a complex cocktail of drugs, the risk of a dangerous interaction or an accidental overdose goes up dramatically, which can ultimately depress the brain right into a comatose state.
And that brings us to Section 3, complications and outcomes. Let's look at the aftermath once those first critical weeks pass.
Mapping this out chronologically, a patient's journey begins with the immediate emergency. Doctors are rapidly running blood tests and brain scans to hunt down the underlying cause. Then comes the coma period itself, which, as we established earlier, typically maxes out at several weeks. And finally, we hit the transition phase. This is the critical junction where paths diverge. A patient might begin a gradual recovery. Alternatively, they might transition into unresponsive wakefulness syndrome, which used to be known as a persistent vegetative state. Or, tragically, the path may lead to total brain death.
We also have to remember that a coma isn't just a brain issue, right? It's a whole body crisis. Even while unconscious, a completely immobilized body invites some seriously dangerous secondary health issues. Medical teams have to actively fight round the clock to prevent bed sores, urinary tract infections, and even life-threatening blood clots forming in the legs. So treating a comatose patient is this massive, ongoing battle to protect the physical body while they wait for the brain to hopefully recover.
As we wrap up this explainer, I want to leave you with a rather profound question to think about. When the human brain powers down to protect itself, how do we actually define the fragile line between healing and irreversible loss? Those incredibly delicate transitions from a coma into gradual recovery, unresponsive wakefulness, or brain death, they really highlight just how delicate human consciousness truly is. It's a wild reminder of the astonishing complexity of our own minds. Thanks for joining me to explore the clinical science behind this. And remember to keep asking questions.